Bienvenue sur ma chaîne YouTube. Hi everybody, thank you so much for tuning in and coming back for another episode. Today again, nursing edition. I'll be doing some nursing interviews, Q&A for new grad nurses, and yeah, a little bit of the questions I came across during interviews and how I answered them and everything. So stay tuned. Okay, so my first nursing interview after graduating was chaotic. It was not a good experience. I felt very unprepared. I went to the interview like I thought I was ready, because with customer service it's easy. Just have to tell them it's just easy. But then you get into the nursing profession where they're asking you like clinical questions and they're asking you to like actually think about the answers, and then it's like testing your knowledge, and then I was not ready for it for sure, because they were asking me questions like I know the answers, but then because I was not prepared for that specific question right there in the interview, it messed me up completely. So and then I appeared, it's like I didn't know like what I was talking about. But anyways, in order to avoid that, today we're gonna be discussing some of the questions so that you feel more prepared than I was, and hopefully that's helpful. But before talking about all the questions, I want to talk about what to wear. So for nursing interviews, you want to be professional. First, please don't wear scrubs. Today I'm wearing scrubs to remind you guys, don't wear scrubs, okay? Don't wear scrubs to your nursing interview, even if you left your first job and your interview is right after work. Try to have some change of clothes. You can wear business casual, you can wear some dress pants, a night shirt, also like I found some inspiration on Pinterest that I'm gonna link up there. And go on Pinterest, try to look for ideas if you don't know what to wear. And nowadays, I don't know, but all of my interviews were online. Either it was a phone call interview or it was like a Zoom interview. So even on Zoom, you want to make sure that you're wearing a nice shirt, you're looking professional, your hair is like tied back or not messy, you know what I mean? Like you just want to look presentable, and you just want to like look like somebody that if it was your company, you would want to hire them, pretty much. So and when you figure out what you want to wear, now we start with the questions. One of the questions that I got in all my interviews, like, tell me about yourself. So this question is like, it's very annoying, because what do I tell you? Like, do you want me to tell you like how new I am to the city? Like, am I supposed to talk about my personal life? Am I supposed to talk about my professional life? So the way that I answer this question is that I will tell them like, I'm a new grad nurse. I just graduated from nursing school in July or whatever, and hey, now I'm blocked. So you tell them you're a new grad nurse, you just graduated from nursing school, and you can tell them about your past experience. If you work as a CNA before, or if you work as a CNA during nursing school, you can say, me, I work as a healthcare aide. So I can say, throughout nursing school, I work as a healthcare aide in an assisted living, where I got the chance to work with elderly and help them with their activities of daily living. And if you don't have any experience, you can tell them about your qualities. You can say you're a really compassionate person, and that is what drawn you into the nursing profession, and you're looking to help people. Like, yeah, just telling about yourself is pretty much like an introduction from you to the interviewer. So yeah, this question, you should be prepared to probably get it, because it's always gonna get there. Like, it's always gonna be asked. And okay, there's another question number 2. They ask you, why our company? Why do you want to work for us? So that's why I say, people, you need to do some research. You want to make sure that you look up the company. You want to know the values, the mission statement. So yeah, do a little bit of homework. And for Covenant Health, for example, their mission statement has something to do with the healing power of Jesus Christ, something like that. Covenant Health. I didn't do my homework. Covenant Health mission statement. So Covenant Health, their values. So yeah, their mission says that they're called to continue the healing ministry of Jesus by serving with compassion, upholding the sacredness of life in all stages, and caring for the whole person, body, mind, and soul. So if you're interviewing for a Covenant Health facility, for example, and they ask you, why do you want to work for us? You can, like, obviously you want to say something that you believe in. If you're a Christian and you believe in the ministry of Jesus Christ, which is the healing ministry, then you can tell them that their mission statement align with your personal beliefs. You're a Christian and you believe that Jesus Christ has the power of healing, and through us is using us to also share that healing power. And yeah, just tell them that you can see yourself working and growing into the company. So yeah, for Alberta Health Services, it's mostly about patient-centered care, right? And being respectful, accountable, all these things. So you want to stress enough that you like their work ethics. I'm having a brain fart, but anyways, yeah, you want to make sure to emphasize their mission statement, their values, so that they know that you also looked up the company, right? And then it's you looked up the company and you were prepared, and it also shows that you were serious about the job, right? Okay. Take my glasses off. Question number 3. So, conflict question, guys. They're always nursing is like a place where it can be problematic, and conflicts is something that you're always gonna run into in the workplace. So employers want to make sure that you know how to appropriately resolve conflict, and how to tackle it and stuff like that. So what I do, so they will ask you, they'll say, oh, you're having a conflict with the patient, with a coworker, what do you do? So you never want to tell them that you're gonna start screaming, you're gonna it's just irrational. So you don't want to do anything irrational. You always want to say that you're gonna be respectful, and you will go to the person, right? So you will go to the person, and then you will talk to the person in private, and you explain to them the situation and try to find a solution from that. And if you're not able to find a solution while talking to the person, then you can add and say that you might want to take it to your supervisor, and from there they'll find a solution. But yeah, we want to answer with respect, and yeah, they don't want to hear that you're gonna make a big deal out of it, you're gonna fight the person, you're gonna swear, and we don't want that. Okay. And another question is about your weaknesses and your strengths, right? So it's hard. Like, if you're not prepared for that question, you don't know what to say, right? So as a new grad nurse, always go with the fact that your weakness is that you're new to the profession, right? You just started, you don't have much experience. So this can be a weakness, but you can tell them that in the meantime, your 2 years of training in school, you believe that the 2 years of training in school has prepared you for what you're gonna face in the workplace, and also you are always looking to like ask questions and receive criticism so that you can have more experience and grow in the profession. So yeah, that's a weakness that you can use. And for your greatest strength, you can tell them it can be time management. For like me, I always use time management because I tell them that I have great time management skills, because I always like have a program where I write my skills, not skills, where I write my tasks, and I prioritize things, and it just like make things flow easily. And yeah, and you can also say that you're teachable. That's a great strength, especially as a new grad, because you don't know much and you're there to learn, and you have to be teachable, right? So yeah, that's good. And another question they might ask you is, okay, why should we hire you? That's where you have to sell yourself, guys. Like, you have to use all that you got to tell the employer that you'll be a great fit. So like, how I say that is, you can start by telling them that you know that there is a lot of amazing nurses out there, and you believe that they've interviewed like a lot of amazing people out there, but you also believe that you are gonna be a great investment for them. You can tell them that you know that them hiring you is an investment, because it's gonna take them time, it's gonna take them so many resources to train you and get you onboarded. It's just so expensive to get somebody onboarded. So you understand that investment, and you just want to guarantee them that that investment will not be in vain, because you see yourself growing within the company. You see yourself being an instructor. You see yourself being an instructor, a nursing instructor in the next 5 years. You see yourself taking on the role of charge nurse, if you like, you know, if that's something that you want to do. And then yeah, and you tell them that you're also looking for a place where you can grow your skills. And you know that, for example, if the hospital is a teaching hospital, you can tell them that yeah, and you know that this being a teaching hospital is going to be a great start, and then for you it's no great start. Don't tell them that you just want to start with them and leave. Just yeah, you can tell them that it's going to be a great facility for you, because as a new grad there's a lot of resources in place to help you learn and navigate and transition into the nursing profession. So yeah, and then you can tell them, you can add more, butter them up. You can tell them that you're very compassionate about patients, and you always care for somebody's calling me. Okay, yeah, and then you can tell them that yeah, you're compassionate and you take care of the patients like you would like to be taken care of if you were like in the same position as they are right now. And yeah, you just wanna like let them know that you're reliable, and yeah, stuff like that. And more questions. They can ask you, oh, tell me a time where you had to deal with a difficult patient. You're always gonna come across difficult patients, and yeah, you just want to think about specific examples, right? For most of my interviews, I felt like I was like deviating. They would say, oh, how do you deal with difficult patients? They like, tell me a time when you have had to deal with a difficult patient. And I'm like, oh, when I have difficult patients, I try to be open, but like give them an example. Tell them, okay, there was one time I was working as a healthcare aide, or one time in my clinical placement I had this patient that it was so hard to approach them, and it was hard to give them their medication or get any assessment done on them, and it was difficult because I could not do any care with them. And you can explain that, yeah, the way that you dealt with it is that you went outside of the room, you gave them enough space, and then you talk to them in a respectful manner, and you try asking them gently if something was wrong and what they needed. And after doing that, they were still reluctant, they didn't let you do anything, and then you decided to go outside of the room to give them more space. And outside of the room, you were doing some reflection, and you were thinking, oh, was I doing something wrong? Did I approach the patient the wrong way? Did I do something wrong? So it's good to like reflect on yourself, and then you saw that maybe you can try something different, and you went back inside and you told the patient, okay, I'm here for you. If you just let me know what you need from me and I will give it to you. And then the patient opened up, and then they told you that they were just a little anxious about discharge because they didn't know how they were gonna continue like receiving care at home and all of that. And then you told the patient that you have staff in place, you have social worker that can come and talk to them, and you have like home care that we can try to have them come to your house. But then in the meantime, we can try, you can just try doing some teaching. And then the patient was receptive after a while, after like talking, and then they agreed to take the medication. So like a specific example like that, right? So just think about that, and instead of doing general, because like for these questions I was being so general, and then the interviewer is like, but can you think of a specific one? So just keep that in mind, and it will be good. Questions. I think I'm gonna go into the clinical questions now, because those were kind of like the general like questions were like just generally about you, but then now there's like situational questions, right? There's like questions where they give you scenarios, and then they want you to work your way through it. So one of like the most questions I received is, okay, you go see your patients, and the patient is complaining of pain, increased pain to the lower leg, and what are your nursing assessments and interventions that you would do for this patient? So these questions is, you just want to think assessment, right? So you go inside, the patient is complaining to pain, so you can ask them, where is the pain? They'll show you the pain. You want to look and see if there is any swelling. So you always observe before you like palpate and stuff, right? So you want to observe if there's any cut, swelling, anything like that. And then if there isn't any, you want to like feel for like temperature, if it's warm, cool. You want to palpate and see if you can like palpate like a clot or something like that, because like for this pain, I think they mean like DVT, right? Deep vein thrombosis, and it happens to the lower legs,
you want to feel if you can feel the clot, and yeah, and you want to have the patient like being stabilized, and then you want to call for help. I always say that, yeah, you call for help when something happens, and while help is coming, you're doing your assessment, and then when you did your assessment and you can see that, okay, the patient is like somewhat stable, then you can go and call the doctor. Then I'll go and call the doctor will like give me directions. We probably have some heparin or something that we can give them, and yeah. And another clinical question that I got a lot is about, your patient is having chest pain, what do you do? So you want to go to the patient, you want to assess, right? You want to assess if the pain is radiating to other places of the body. How much pain are they in? Like, they'll rate the pain, and yeah, you call for help, because you don't want to deal with like situations like that on your own. You can pull the call bell, you can yell, you can ask for help, and yeah, and you want to take like a set of vitals, right? And then just to have a baseline to see where the patient is at, and you want to check for history, right? Maybe they have nitroglycerin that is already ordered for them. Maybe you can administer that. But then if the patient is in so much pain and you can clearly see that the whole situation is escalating, depending on where you work, like facilities, right? You can say, oh, you're gonna do like the policies, you're gonna follow the policies and procedures for this specific like facility, for this specific facility. But then it's also like so easy for every situational question that they ask me, you're like, oh, I'm just gonna follow policies and procedures. Like, no, you want to give like some, like, what do you think you would do, right? And yeah, if the patient doesn't have any history of like heart problems or chest problems, and they're in so much pain, and you're in a long-term facility, you want to call 911. 911 is gonna like direct you through what to do, and they're gonna send the ambulance, and they'll come and get the patient and take them to the hospital, because chest pain is really serious. It's not something we want to play with. Chest pain is a really bad sign, okay? So we want to intervene. We just don't want to leave it like that. And if you're in the hospital, then it's a different thing, because you can't call the ambulance, right? What do? So you ask for help, and you check all of these things, and maybe the person like coming to help you can go and give the doctor a call, or you can call the doctor and get directions and what to do, right? So that's good. Okay, another question I get is another situational question. So you went on break, and then you forgot something at the nursing station, and you're on your way back, and you see Mr. how are we gonna name him? Mr. A in his room on the bed. The bed is flat, and then you can clearly see that he's having difficulty breathing, and then he's telling you, oh, I can't breathe. So what do? And Mr. A is not your patient. What do you do? Okay. We're supposed to be good Samaritan, okay? We don't want to be like all these people that walk by the person that was sick on the side of the road and did nothing. We want to be the good Samaritan. You want to stop and go and help, regardless that it's your patient or not. When you see somebody, a patient that is in distress, you have to go and help them. So you'll go in there, you will first of all, first intervention, you want to elevate the head of the bed, okay? That's the first thing. That way you elevate it 30 to 45 degree angle. That way the lungs can expand and the patient will be able to breathe better. And after you do that, then you can pull the call bell, or you can yell, and you can get somebody to help you, because you don't want to deal. It is better to have two brains than one brain, you know, in situations like that. So you call for help. While help is coming, you take your baseline vitals, right? and you take their pulse oxygen, you take blood pressure, temperature, everything. And then they might need a little bit of oxygen. And when help gets here, hopefully the primary nurse that hopefully knows the patient better than you do will get there, and then most likely the patient will be better with like the bed intervention and maybe the oxygen. And then after that, you can document your find, like what happened, because you always want to chart. They say it didn't happen until it was charted. Like it didn't happen until if there's nothing to support that you actually did it, right? So you want to go charting, and then after that you can talk to your partner and explain to them, oh, I was on break, but then this happened, and then you can probably go back on break and finish your break time, right? So yeah, that's how you would deal with somebody in a bed that is flat and they're not like breathing easily. And there is also one question that threw me off one time. They're asking, they're like, oh, what would your past, can you tell me 5 qualities that your employer would say that you possess? And then I was like, I was able to answer it, but then I just had to like think about it a little bit. But yeah, you can say that you're respectful. That's a good quality to have. You're compassionate in your care because you treat people the way you would like to be treated. So that's really good quality. You can tell them that you're organized. Just think about like 5 things that are really like, that you actually possess and that, that are good. And after the interview, they'll tell you, okay, that was all the questions we had, and they'll ask you, do you have any questions? So I feel like it's always good to ask at least one question, just because it shows that you were listening and then you're also interested. So one of the questions that I like to ask is asking them, oh, is there something from my resume or my answers that were like alarming, or is there like something that you would like me to clarify for you that I have not had the chance to do? And this question is really, I like this question because it's kind of like asking them for a little bit of insight. The way they respond to that question helps me determine how the interview went, right? So I can like tell if it was not good at all, and I can tell if like it was good. And also I like the question because it helps me improve my answers, because them telling me, oh, this question, like we were expecting you to say something in the lines of this, blah blah blah, then you can add it to your note and you're like, okay, next time you have an interview, that's how you're gonna like answer it and what you're gonna add to the answers. And yeah, that's actually what helped me from my first catastrophic interview to where I am right now. It is like asking questions and for feedback really helped me like improve my answers. So yeah. And another question that you can ask is ask them how their training goes. Like, how do they train people, how many days do they train, like just things like that. Or you can ask them if they have like any like education program in place for new graduates. How do they support their new graduates, just to show them that you're really interested in working there and you can see your future with them, and you're just trying to see if there's something in place for you. And yeah, that was the last question that I had. And I hope it was a very beneficial video for you guys. I hope I answered enough questions, and let me know if you want to add more to my answers to make it better. And yeah, thank you for tuning in again, and see you next time.